Okay, good afternoon, everyone. Thank you all for joining us today. My name is Luke Keeler, and I'm a business development and outreach specialist for the North Carolina Health Information Exchange Authority. So today, the main purpose of this meeting is to have a short overview of NC Notify, one of the services that we offer, and also talk about the NC Notify dashboard. The presentation today is going to focus on, what you can expect to see when you go to the NC Notify dashboard within our clinical portal and ways that, you all can use the dashboard for your own team and for your own workflow. We'll talk about the layout of the dashboard along with exporting and filtering options so you can filter down to see the notifications most meaningful to you and your team, along with a few other aspects of NC Notify. Let's go on to the next page. All right, so very quickly, these are just the services that we offer as the North Carolina Health Information Exchange Authority. We do have the clinical portal where you can access patient health records. We also have NC Notify, which is the service we'll talk about today. That's our event notification service, where it sends you notifications in near real time of events happening with your patients. We also have the controlled substance reporting system, which is a single sign-on kind of pass-through that's within the clinical portal. You must have previous access to that system, but you can access it that way without having to sign in and open a new web browser and sign in using a separate username and password. We also have direct secure messaging, which is where you can send secure and encrypted PHI from one provider to another, and also different public health services that are available, like the diabetes registry, the stroke registry, public health lab reporting, and a few others. But today we're going to focus on NC Notify. And this is one of the services underneath the NC Health Connects umbrella. So this slide just kind of shows the overall goal of the NC Notify service, which is to keep your providers and care teams in the know when events take place with your patients, and also when they receive care outside of their normal care network. So for example, if they are admitted to the hospital, and basically in near real time, once that person has been admitted, that information is sent to NC Health Connects, and then you, because you're following that individual patient on your patient panel within NC Notify, you'll receive an real-time notification that that patient has been admitted to the hospital. But basically what you see here on the screen is an illustration of that. So starting at the top is the little greenhouse, and that represents your organization, and the patient is shown here in purple, and they are assigned to your facility. And we know about this patient because when you enrolled in NC Notify, you completed the paperwork, and we asked that your organization send us a patient panel of the patients you'd like to follow. And basically, it's just a list of patients that you're actually monitoring, and we monitor that patient list for you. So we take that list of those patients that you've given to us, and when they visit another health facility or organization, NC Notify will send you a notification in near real time, letting you know some high-level details about that particular visit. In this example on the slide, when your patient receives care at the other facility, an admission, discharge, and transfer message, or an ADT, is created and sent to NC Health Connects. In this depiction, when the patient went to the emergency department, they had an X-ray along with some other tests, and this represents the ADT message that is sent from the facility where the patient was seen to NC Notify. And once our system flags that alert, our system will match that patient with your facility and immediately send you an event notification to your NC Notify dashboard. So once you receive the message, that will allow your team, the opportunity to go ahead and provide follow-up care for that patient, or reach out to that patient, or whatever you feel is most appropriate for their care coordination. Now, in this example too, you can see that the individual had an X-ray completed. Now, we don't actually collect images and store images within NC Health Connects. So in this case, it would just be the report of the X-ray or CT scan or MRI or anything that was done that would be sent to NC Health Connects and then pushed out to your dashboard. it would not be the image itself. If you want to be able to access the image, you could request the image through direct secure message to the other provider and request it that way, and they could send you the image through direct secure messaging. So some of the benefits of having NC Notify is that providers get notified when their patients receive care in other settings. It helps them also schedule follow-up appointments with patients for transitional care management. It also helps them follow up on medications that were prescribed or other discharge instructions. It also provides insight to provide continuity of care and reduce avoidable readmissions. One of the other great benefits, it does improve insight into achieving financial goals under value-based care contracts. This is especially true for providers who are members of an ACO. And it can assist with compliance and with state and federal quality initiatives, including meaningful use and promoting interoperability. And as always, you can see more information about NC Notify by visiting our website. You can also email the HIE at nc.gov, and we'll be sure to send you more information or technical specifications and documents in regarding to NC Notify. So some of the newest features of NC Notify are auto attribution, which you will not need to provide a patient panel to us, but the HIE will automatically see what patients you work with through your EHR, and if their data enters into the HIE from a hospital, it will automatically be sent to your NC Notify dashboard. And this only can occur though if you are currently connected to NC Health Connects and live in production. Otherwise, you will need to send a patient panel to us, which is a list of all the patients you want to follow. And one other thing is that you can access the NC Notify dashboard within the clinical portal itself. You don't have to access it from another browser window because it lives right within the clinical portal itself, which is great because you don't have to sign into another system. So I just wanted to review the steps of onboarding process. Most likely, if you are watching this, you've probably already been through this process. You've completed most of these processes actually for your organization. And in most cases, you're probably already live in the system and receiving notifications. But again, just go over the steps we wanted just to review. So the step one is the enrollment or the migration process. And the NC Notify team, they will assist the participant to initially enroll or discuss steps to migrate to the upgraded service. And step two is the onboarding call. So this call walks the participant through all the available options and upgrades of version 4.5 and version 4.5 plus. Once the best options have been selected from your team, the NC Notify team will send all necessary forms and documents for next steps. Step three is that the forms and documentation, and the participant will collect all internal signatures and complete the necessary documentation. To enroll in NC Notify, participants must have a signed NC Health Connects full participation agreement and a completed NC Notify enrollment form, and which includes a patient list that the participant would like to track, and a mechanism for receiving alerts. Now again, right now we do say that you need a patient panel, but again, if you're already submitting data to us and you want all patient notifications, we can send you those. But if you do want to list specific or follow just specific patients, you will need to complete a patient panel. Step four is the technical preparation. The NC Notify SaaS team will work directly with the participant to build the connection for the version of the service that the participant has chosen for their healthcare organization. Step five will be the patient panel validation and testing phase. The NC Notify team will test all connections and patient panels sent by the participant to ensure that the data flows correctly and is monitoring all patients on the panel. And then step six will be welcoming you aboard the NC Notify dashboard. So the NC Notify team will inform participants that they have successfully completed onboarding and their notifications are in production. They will now begin receiving notifications on the patients that they have chosen to monitor in the form that they've chosen to use. So this is just another way to showcase how NC Notify operates. Again, you will need to subscribe to the NC Notify service and inform us of the patients you want to follow. But NC Notify will start to monitor all clinical data feeds coming into the HIE for any matching event or clinical data of interest to the subscribers. These events will then be pushed directly to you and via the NC Notify dashboard in the clinical portal, or you'll receive a flat file that you can upload into your own EHR. One important thing to know is as well is that you can receive event notifications or data through batch notification files in delimited or HL7 format, the near real-time notifications via HL7 messages, and as always in the web-based NC Notify dashboard via NC Health Connect's portal. Typically, the majority of individuals access this data on the NC Notify dashboard, which is within the clinical portal. But we do have some individuals that ingest the data through flat files that they upload themselves to their own EHR. And typically that is when they have their own IT team that can handle that particular procedure. If not, you'll most likely just use the NC Notify dashboard to access the information. So we do have two tiers. This was the version 4.5 and the version 4.5 Plus that I talked about briefly. So the base tier is targeted at organizations that can generate a patient panel, and they may wish to integrate notification files into their own systems and often have a high volume of patients for whom they would like to receive notifications. Most base subscribers are payers and participants using third-party organizations such as ACOs or CINs, and that do not provide that direct patient care. So this service tier offers standard ADT event notifications, and the patient panels are submitted via SFTP or DSM. And there are three options for notification delivery. They can be batch notification flat files delivered via SFTP. There also can be HL7 notification messages delivered in near real time via SFTP or TLS. And also we do have CCD notification messages delivered in near real time via SFTP or TLS. And then we also have the Plus tier. And with the Plus tier, it is suitable for organizations who want to leverage the enhanced features offered for building patient panels, coordination of follow-up care activities, having a web-based portal for viewing the notifications, and advanced alerts in addition to the standard ADT notifications. It primarily supports subscribers that provide direct patient care and may not have the resources to ingest the notifications into their own EHR. Excuse me. So the Plus tier uses Point-Click Care, and that is a third party's event notification service, and it's a web-based dashboard feature, which the HIE has rebranded as the NC Notify dashboard, and it lives within the clinical portal itself. So SAS, who is our technical partner, they sends the ADT messages received from NC Health Connect's participants to Point-Click Care in near real time to generate event notifications for the Plus tier. And then the Notify dashboard is accessible through the single sign-on from the NC Health Connect's clinical viewer portal. So, and we'll go over kind of what the portal looks like, or we can call the dashboard demo. But in the meantime, the Plus tier offers two additional options for patient monitoring. Those subscribers with a data connection to NC Health Connect may choose to enable auto attribution for patient monitoring. And this Point-Click Care feature builds a patient panel for the subscriber based on the encounter data received through the subscriber's data connection. And also, in addition to the option for viewing notifications via the Notify dashboard, the Plus tier also offers near real-time notifications delivered direct secure messaging, and also a tickler email option where subscribers receive an email with no PHI included, letting them know that notifications are available to view on the NC Notify dashboard. Now, I do want to clarify that a lot of providers, they may originally think, oh, this is a great idea having emails come into me every time there's a new notification. But if you're monitoring a large number of patients, you will quickly dislike this feature in this option. If you're only monitoring very few patients, then you may like having an email sent to you saying, you might get one a week or two a week or something that you could handle. But when you get hundreds of emails per day of these event notifications to your email inbox, you may not like it. But it is an option that is offered. So now we're going to review some of the notifications that we do offer. So all these alerts are standard ADT alerts, and they're only available on the Plus tier. So if you are participating in the base tier plan, these notifications because you're ingesting all of your data yourself. Whereas if you're on the Plus tier, again, you're using the point-click care system that's been rebranded as NC Notify. And these are the notifications that are available for you to use. Now, you don't have to get these notifications and subscribe to all of them. You can just pick and choose one, two, or more, or all if you choose. So we do have admission, discharge, or transfer notifications. And that, again, will be a notification of any visit by the patient within the NC Health Connects network. Now, this is available on both the Plus tier and the base tier. We also have the high utilizer alert, those notifications of at least 2 emergency department visits in 90 days, or at least 4 inpatient admissions in 12 months. This is only available on the Plus tier. We also have dental alerts that providers are alerted when patients visit the emergency department for dental care. That's also on the Plus tier. Again, this is not if your patient just visits a regular dental facility, a dental clinic for standard dental treatment. This will be for when the patient receives dental care within an emergency department. We also have care team change alerts, and providers will be informed when a new organization has subscribed to their patient. So let's say the patient has visited a new provider, and that provider has now started following this particular patient and receiving care alerts. You'll receive a notification that your patient is being followed by another provider. We also have diabetes diagnosis alert, and providers are alerted upon a new diabetes and or pre-diabetes diagnosis for patients they are monitoring. This also is available on the Plus tier. And then we have the chronic care management alert, and that is providers receive an alert when a patient meets the Centers for Medicare and Medicaid Services chronic care management services criteria. This is also available on the Plus tier. So these are just screenshots of mocked up notification messages. And this flat file notification example is displayed in Excel, and some columns are hidden to provide a view of the event details, but each row of the notification file will consist of the values from the patient panel and additional information generated by Notify. So the demographics for patients are taken from the subscriber's patient panel, and this ensures better matching at the subscriber system because there's consistency between the demographics on the panel and in the notification. Here you'll see an example of the source sending as the facility value instead of the name, for example. So HL7 messages can be sent as flat files or as individual messages over a standard HL7 interface. And the data sent to a subscriber is dependent on the data being sent by the organization where the event actually takes place. So demographics for the patients in the HL7 notifications will come from the event source. Typically, there'll be HL7 version 2.5.1 messages. And then we also have the CCD messages, which be formatted according to the Consolidated Clinical Document Architecture, which is the CCDAs. And that's the CCDA standard that we follow. So they'll contain that longitudinal clinical data from NC Health Connects for the patient, including demographics and spanning multiple sending organizations. So data sent to a subscriber is dependent on the data being sent by the organization where the event takes place. So no subscriber is receiving this type of notification currently. That is something to know. So we thought it'd be important to show you how to access the NC Notify dashboard. And you'll first need to log in using your login credentials to NC Health Connects portal, and that's here shown on the screen. Since you are here today, you have probably already gone through the enrollment process, and you have probably already received your login credentials to the NC Health Connects clinical portal. And this again is the first step in getting to the NC Notify dashboard, and that's because the clinical portal and NC Notify are 2 separate systems, but one system is housed within the other. So the NC Notify system is actually housed within the clinical portal, so it allows you to have only one username to access both systems as long as you have the correct permissions. So what you're seeing here is a screenshot of the login screen for the NC Health Connects portal. And That's how you'll use your username and password to sign in. Once you sign in and enter in your login credentials, you'll have to agree to this disclaimer. And at that time, you'll land on the NC Health Connect's portal landing page, which is exactly what you see here. So the disclaimer basically is asking you to consent and agree to abide by all applicable federal and state laws, along with the NCHIA participation agreement, which of course every organization who has access to NC Notify and or the clinical portal has signed, and that participation agreement has been executed. Currently, the screen also notifies you that we do not accept 42 CFR Part 2 data, which is basically alcohol and drug abuse data or any type of psychotherapy notes. We don't carry them or have them or store them in the health exchange. This disclaimer is just updated, so it will change over time, but once you agree, it'll take you to the next screen. If you do hit the disagree button, it will take you back to the sign-in page. So just read through the disclaimer and click agree, as this will pop up each time that you log into NC Health Connects. And again, you may already be familiar with this because you've already used NC Health Connects and you've just now started getting access to NC Notify. So once you've signed in, you will arrive at the main landing page for NC Health Connect's portal. If you are granted clinician access, you'll be able to search for patients within the portal. But if you are only given administrative access, such as the participant account administrator, you will not be able to search for patients. But it's important for you to be granted the correct permissions to NC Health Connects and the services within, the portal, such in this case would be NC Notify. So if you do have any questions, always reach out and speak with your PAA to evaluate the permissions that you've been given. If you are in this training, most likely you have the permissions of clinician access. And again, this is the landing page for the portal, but we will not be focusing on searching patients today. Our focus is on accessing the NC Notify dashboard. And across the top, you'll notice the tabs on the blue ribbon. Here you can find that on the NC Notify tab, and that's actually here along the side. And you will arrive on the main landing page. So this is the icon that you want to click on, which is the icon with the bell with NC Notify written next to it. And on this particular slide, NC Notify tab is highlighted here in red. You'll want to click on the drop-down arrow next to the NC Notify tab, and two drop-down options will appear, and you'll want to select the first one titled View Notifications. This will take you to your NC Notify dashboard. The Upload Panel tab allows you to upload your patient panel if you need to update the patients you are following. This would be how you notify us of any changes in who you want to follow. But for today's purposes, just make sure to click on View Notifications. I did want to point out that if you are live in production and submitting patient health data to us, we have something called auto attribution, which we've already talked about, but just to reiterate, that's where our system automatically recognizes that they are a patient of yours, so you won't need to send us a patient panel anymore. But in this case, you would be receiving notifications for every patient, which can be a lot of patients for most providers or organizations. So you might want to follow specific patients, and if it is the case, you would want to submit a patient panel. So this is just a reminder that once you arrive at the NC Notify dashboard, if you have not been granted access to NC Notify, this is a screen that will appear explaining that you have not been granted that access to view the NC Notify dashboard. And if you would like access, you would need to please contact your participant account administrator or the PAA for your organization, and they'll work with the help desk to get you access to the NC Notify dashboard for your organization. So this is an example of a plus tier notification received via direct secure messaging. And it just shows that, again, you can receive these messages, these notifications through direct secure messaging, which notifies you to then go into the clinical portal or to view the NC Notify dashboard to view the notification. So this is an overview of what the NC Notify dashboard looks like. You can filter by patient name or medical record number or patient ID, which is pulled from the patient panel submitted by the participant. You can also search for the facility displays. You can also have the feature of saved custom filters and add filters. These are all located across the top banner, which is highlighted in blue. On the left-hand side is the list of all notifications. So you will see the notification count, and that is the total number of notifications for a specific tab. You'll see the timestamp for when they were last updated. You'll see the notifications are purged after 180 days. That's just important to know. We don't keep them in the system forever. Also, you'll see there are tabs, and these organize the alerts by their status. So we do have all alerts. We have a tab for not started. That's the default for new alerts. We also have in progress tab, and those are the cases you're currently working on. And we have the completed tab, and those are the alerts that you have followed up on and completed and mark them as such. So the status of the alert is changed by clicking on the circle icons next to the patient's name in the boxes on the left side of the screen. So an empty circle is not started, a half a circle is in progress, and a full circle is completed. And that, of course, corresponds, as you see, with the circles that are in the tabs next to all not started, in progress, and completed. The alert will include the patient's name, their gender and medical record number. It includes the event facility, the date and the time of the event, the patient class and the event type, the reason for the visit, and the patient's complaint. You will also see that there is a download button, and this allows you to download the list of notifications as a CSV file or an Excel file that you can view in Excel or upload to another system. We also have the right-hand side, and this is where the notification details will appear. And so if you click on the actual notification that's on the left-hand side, you'll see more details on the right-hand side that'll open up, and I'll show you what that looks like now. So again, this is just an overview of the dashboard demo. You can see the notifications along the left-hand side. In this example, the person was having chest pains. Another had 3 infected toes, and there's other ones further down. But I just wanted to show you kind of an example of what your Instant Notify dashboard might look like. All right, so one thing that's important to know as well, that organizations providing tailored care management will be required to have access to ADT data that identify when members are transitioned into or out of an emergency department or hospital, and that does occur in real time or near real time. So organizations providing that tailored care management will be responsible for ensuring that there are systematic, clinically appropriate processes in place to support those care transitions. And generally, you'll have a designated care manager staff actually be responding to certain high-risk ADT alerts. That could be those real-time alerts, those responses to ED visit notifications, where you'd probably be responding within minutes or hours of receiving that notification. There would also be like the same day or next day outreach for designated high-risk members, and then additional outreach within several days for those discharged from a hospital or ED, just to confirm, any of their outpatient needs and make sure they are being addressed. Make sure they're taking their medication, any other visits they need to follow up with. And then this is the dashboard that we're actually going to display a little more in detail today. So again, across the top, these are allowed. You can filter by patient name, medical record number, create filters, add filters, and then of course on the left-hand side you will see the list of notifications. And once you click on the notification, you'll notice now that it's highlighted in blue, and then that person's information, that person's name, is now on the right-hand side of the screen. So again, once you click on that event notification, this blank space that originally was on the right-hand side of the screen will now be filled with details about that particular patient. All right, so we have talked to users before, and they wanted more understanding of what the different aspects and areas of the dashboard are. So this slide kind of highlights those areas that are used most often by the NC Notify subscribers. And So for each of these breakdowns, I'll just go by the numbers that are listed. So the first number here is the care coordination or the progress tabs. And these tabs will help members of your team better understand just at a glance which patients have been interacted with. So as new alerts appear on the dashboard, they will land within the all or not started tabs by default. And this is because they have not yet been engaged with by any type of care team member. And so they all will appear there. The second bubbles that we'll want to review today, the second section, we call the status bubbles. And those bubbles work directly with the tabs in section 1 that you see across the top. So as an example, if patient A lands in the local ED and they have an elevated blood pressure, let's say, that alert will land on the dashboard. So let's say when the nurse, they see the alert and they start to follow up procedures, they'd want to click in the middle bubble and then say that this particular alert is now in progress because they're starting to follow up with it. When the follow-up work has been completed, that nurse would then select the completed bubble. As the bubbles are selected, the event notification for that particular patient is sent to the appropriate tab. So all team members within that clinic will have the ability to see which patients are in progress and which patients have been completed they don't need to follow up with any further. And this does help to avoid multiple team members reaching out to the same patient. These status bubbles are a really great tool for care coordination. It's particularly for those teams that have multiple users or multiple care managers who might be logging into the same dashboard at the same time. So for example, if my coworker and I are on the same team and we log into the dashboard in the morning and I engage with, let's say, the patient number 1 who's at the top. And then when my coworker logs in an hour after me, she won't be able to go and reach out to the same patient because she can see from the status bubbles that someone has already engaged with that patient. So as we work through these bubbles, you'll notice that there's 3 tabs at the top, not started, in progress, and complete. So they have a direct relationship with the 3 bubbles, on each of the chart notifications. So going back to this example, when I come in the morning and I look through the list of encounters over here on the left, I'll engage with the patient number 1. This alert, which is focused on high blood pressure, so I want to reach out to the patient, follow up with them. When I click on the chart, more detailed information will appear on the right-hand side. And then after I've taken a look at the basic information, I can then go ahead and call the patient. And while engaging with that patient, I want to click on the appropriate status bubble. And in this particular case, I would click on the one in the middle for progress, or in progress, I should say. And just remember that this tool is mainly for your team to know whether or not someone has engaged with the patient. So I pick up the phone, reach out to her to schedule a follow-up appointment with the patient. Once I get that follow-up appointment scheduled, I'll go back and click the appropriate status bubble, which is the third one, showing that the task was completed. So once again, benefits of this tool is that it just lets everyone else on your own team know that someone's already working on this particular alert and they don't have to start it or follow up with and then the patient receives multiple phone calls. Another benefit is that at the end of the day or at the end of the week, someone in administration might want to go through the dashboard and take a look to see how many follow-ups were scheduled this week. They could click on each one of these tabs and see how many are in progress and also how many patients are currently there that they're currently working with, and then also the patients that haven't been contacted yet at all. And of course, the ones that have been completed. So by clicking on each of these tabs, it will adjust the view, which will be specific to the tab that you've selected, or the status bubble you've selected. So number 3 is the export button, and this button allows your team to download and export your event notifications to an Excel file for any type of further analysis if you need to do so. Some clinics have informed the NC Notify team that they like to export the data so they can divide the work up between all of their team members, and to help review their in-house analytics just to look for patterns within their notifications. Now number 4 at the top right, this is the filtering field. So this field allows users to build filters by keywords within the notifications. So, the goal here is to help users find the notifications that are most meaningful to them. So for example, when you first log into your dashboard, you will see a full list of notifications on the left-hand side. But say, for example, you only want to see the notifications for high blood pressure. You can go to the filter dropdown and apply a filter specifically for high blood pressure, and this will allow you to only see the notifications you want to see and not the entire list. These filters can be very specific to include things like event type, the time or the date of the visit, if it was a primary care provider or any other provider, and there are other options as well. On another slide, I'm going to actually showcase some of the filtering options. So here now is, again, we're just looking at the dashboard, but this slide illustrates the view basically of the event notifications and how they land on the left-hand side of the dashboard. And on each alert, there are 4 high-level details shown to the user. So they'll quickly have a general idea of who the patient is, what type of encounter happened, where it happened, and the date and time. Now again, not all this information will appear. If the information was not sent to us, then that data will not be there. So the patient's name and medical record number, they generally appear at the top of the notification, and that's followed by the location of where the patient was seen at and the place they received service or care. The next is the time and the date of that visit, and then probably the most important information for you all is basically the highlighted in red boxes that you see on this slide. And that is showcasing the exact place on the notification where the visit details can be found. So the first one showcases a maternal prenatal visit alert for a patient with hypertensive disorder, while the second shows a maternal prenatal visit alert for a patient with diabetes. So basically, when you're scrolling through the dashboard, you can quickly scroll down and just take a look and see the types of events that are taking place. And again, the right-hand side of the dashboard, after a notification has been selected or clicked on, the additional details will appear on the right-hand side of the screen, where previously when you first sign in, that right-hand side will be blank. So on this slide, you'll notice the In Progress tab has been selected. And this is just an example of what a team member might see at the beginning of a day when no patients have been engaged with. So if you know that someone has started working with a follow-up, at the end of the day yesterday and said they will continue with that patient in the morning, it would show up here as it's still in progress. And then they can continue to follow up by reaching back out to that patient. And once they're finished, they'll then mark the status bubble of complete, and it'll move from the In Progress tab to the Completed tab. So on this slide, you'll notice it's the same one. Here is the slide for the completed tabs. And once you select it, you'll see it highlighted in yellow like you see here. And this is just an example of what a team member might see at the end of a day, showing all of the completed encounters. And by the way, I don't think I said this earlier, but the reason why I'm showing you these screenshots is because we don't have a demo environment for the NC Notify dashboard. So that's why these are just screenshots of what the dashboard looks like. So let's say, you've been quickly going through the notifications and you see one that catches your eye and you want to know a little bit more detail. So you just need to click on the event notification, which is on the left-hand side, and the visit details can be found here on the detail chart that will appear on the right-hand side of the screen. So all of the information on the smaller notification on the left-hand side is actually being fed from the larger, more detailed notification on the right-hand side. So you can see on the right-hand side, there are a lot of fields that are bolded. So NC Health Connects is the organization name in this particular example. And so the date and time is being pulled from the event date field. And, what will be most important to you all is the event type, the alert note, and the diagnosis description. So this is just a closer view that shows additional details about the alert. So this has just been zoomed in so we can focus on the information of the alert type and the alert note within the notification, as this will most be important for you all. I want to point out that these bolded fields, because they may be most helpful to you, especially when you start to think about applying filters. You may decide that you only want to view the notes from the last 24 to 48 hours, and so you'd want to filter using event data. So, you will learn as you go about the best way to create and build those filters, but basically anything that's highlighted on this slide are the fields that you can filter for. So these two sections have been beneficial for other NC Notify subscribers as well, and these sections can be found on the right-hand side of the screen after engaging with or clicking on the alert for the review. So again, you've clicked on the message on the alert on the left-hand side, and then you'll see all the information that pops up on the right-hand side, and this is what you'll actually scroll down to see more and more information. So now we're down to the event history, and that'll be under the event details, and this shows some other events that have recently happened with the patient. It will tell you about other ER visits or inpatient visits, along with our high-level overviews of the patient's recent medical care and history. So every chart may not have this because there just isn't any information to populate it. Again, we're not fed all information. So if the information is fed to us, it will be populated here in the expanded event details section. But if we don't receive it, it won't be listed here and it won't populate here. So there are a variety of different filter options that can be used to improve the view of the notifications that you're actually wanting to look at. First, if a user has access to more than one participant's notification panels, again, that means basically they've submitted more than one patient panel. They can click on the participant dropdown to see notifications from a single panel or all panels combined. Additionally, a user can filter by specific data elements in the notification using the Add Filters dropdown, which you see here highlighted in red on this slide. And for example, your filter you might want to add would be the number of ER visits, the diagnosis, maybe it was the chief complaint you wanted to look at, or the primary care provider, the event type. This feature allows a user to apply any type of specific search criteria to the notifications view. So for example, a user could search for frequent ED utilizers with filters for patient class equals an emergency. The event type could equal a discharge note, which was considered the AO3. And then you could also do the number of ER visits. So to do this, you'd want to click on Add Filter. And what you see here is a list of the options, and there are 50 of them in all that you can choose from to filter by. So once a filter option is selected, another drop-down list of other actions will appear. And that may be like this option then contains or does not contain, it equals this or does not equal this. And when you select one of these actions, you may see another drop-down list. And this just depends on the filter that you've selected. So for example, patient class will provide a drop-down list containing, multiple options such as emergency, inpatient, outpatient, or maybe it's not even applicable. And in that case, there may not be other further drop-downs for any of the provider fields. But you also can enter free text to add a filter as well. And in the instance where an additional drop-down list or calendar is not provided, we find that if you use the contains action, that tends to be more suitable for free text entries. And then to save this, you'll want to, under the add filter field with that floppy disk icon that I showed earlier, you want to type in the name of the filter and click the disk icon to save that filter. And then that filter will appear under the saved custom filters list. But the one thing to know is that filters, once they're created, they can't be edited once they've been saved the first time. So if you want to create a new filter or change the filter, you must delete it and rebuild a new one, or you keep that old one for using it in other purposes and then create a new filter specific to what you're looking for. Another unfortunate thing is that even though you all share the same dashboard and you're looking at the same notifications and status bubble information, if you create a filter, that filter is specific to you. it's not to anyone else. So if, let's say, you've created a filter and you want your entire team to use it, you will need to teach them the steps of creating that same filter you did, and then make sure each person who has access to their own dashboard creates that same filter. So this slide is what your team can expect to see when trying to build a filter. The drop-down menu will appear showing multiple filtering options. And once you've selected the appropriate field, you'll have another drop-down appear again. So instead of the previous slide, you saw all the different filtering options. This, you can see that once you've selected on a field that you want within the drop-down, another will appear showing those additional options that I spoke about earlier, like contains or does not contain, equals or does not equal. From there, you'll have the ability to enter keywords to help build your filter and narrow the focus down to be more specific to the events you actually want to see and want to follow with your patients. So let's say after applying the filter for high blood pressure within the last 24 to 48 hours, and the number of notifications have been decreased from 61 down to 15. You'll kind of want to print this out to give it to your coworkers. You can click on the black arrow pointing downward, which is the export button, or the drop-down arrow, and you'll want to click on the filter notifications. You can create a file name and then click download. If you click on all notifications, your Excel spreadsheet will be all 61 notifications instead of the 15 notifications you have filtered for. Just know when you sign in to the platform, you'll see, and it might say 61 notifications, but know that throughout the entire day, as the notifications come in, that number will continue to rise. And also just remember that after 180 days, those notifications will be deleted from the dashboard. So this is just an example of how the exported file will appear as an Excel spreadsheet if you were to download it from the dashboard. One thing to point out is that, on each of the row numbers, these are the same bolded fields that you'll see on the NC Notify dashboard. So the top row, the MRN number, the first name, the last name, the date of birth, those are the options that you filter for. But again, these are the bolded types that you see here on the actual event details. All right. So this is just a list of important links for NC Notify. The base tier and the plus tier specifications, they do vary due to the different features that are offered in each tier. So you can learn more information regarding those particular different, the base tier and the plus tier. We also have several enrollment forms available on the website. We do have a link to the online form. There's also a link to a fillable PDF form, and there is a link to the fillable PDF form for payers as well. And this is where you can get more information. If you do have questions, you can always reach out to us via telephone or by emailing us. And if you have questions for the HIE support help desk, you can also reach out to them as well. I hope this has been insightful and helpful for you learning how to navigate the NC Notify dashboard. And again, we are here to help you through that process, so please contact us with any questions. Thank you for watching the NC Notify overview and dashboard demo, and I hope you have a great rest of your day. All right, bye-bye.